It's got a message for the folks there, and one of the fellows who does not agree with the President of the United States is Congressman Roy Blunt of Missouri. He, interestingly enough, is running as a Republican candidate for the Senate in Missouri and has been a leading voice against health care and a leading voice on trying to get the GOP's version of health care out there of late. Congressman, thanks so much for being with us, sir.
Hey, Rick, it's good to be with you, and I'm glad you mentioned that second part because there are lots of things that could be done to improve the health care system. A few of them may even be in this monstrosity of spending bill that the president's talking about. But
yeah, here's
the Missourians he's going to see today are not for this.
Here's one. Look, President of the United States says every year $98 billion is lost because of money that is given to the wrong people or given for the wrong reason. He says Medicare and Medicaid fraud is through the roof, and he's going to assign auditors compensated based on the amount of improper payments they identify and that are reclaimed for the American taxpayers. That's a Republican idea. That's Senator Coburn's idea that the president's going to be talking about in your home state today. What do you think of that?
And even if that is a good idea, you ought to use that money to save Medicare and help Medicaid. It's not like these programs we've already committed to are in such good shape that we don't need to worry about them. Everybody knows that Medicare particularly gets in big trouble as early as 2017. Only the federal government would say we're going to take $500 billion from Medicare to start a new government program, as opposed to we're going to find savings in Medicare to save Medicare. This is a no-brainer anywhere else in America. Only in Washington would that even be a reasonable thing to talk about.
But isn't it also a no-brainer, though, sir, that if you have the WHO saying you're 37th in the world in health care, if you have 47 million Americans, arguably, I know that number goes here and there, all numbers can be played with, but if you have 47 million Americans who don't have health insurance, if you have health insurance costs and premiums going through the roof, and you got small businesses saying, I can't afford to insure my people anymore, so I got to close my doors, you got a problem, right? We've got to do something.
But Rick, you've got a bigger problem if you try to solve this one by spending $200 billion a year. If this was a great plan, which it's not, we couldn't do it and shouldn't do it because it cost way too much. There are lots of things you could do in health care to solve those problems that wouldn't involve taxpayer dollars, and where you did spend taxpayer dollars, you could save that many more dollars by doing things like medical liability reform, small business or association health plans, buying across state lines, leaving kids on their family policy longer than we do now as they're young adults. There are lots of things you can do, but the number one reason not to do this is it costs way too much. They're going to raise $1 trillion between Medicare cuts and tax increases over a decade. Then they're going to spend all that money in about 5 years. It's not a good plan, but it costs too much even if it was. The American people know that. That's why 2/3 of them are opposed to it.
But
they're not opposed to it because they don't understand it well enough. They're opposed to it because they do understand that this is not the kind of health care reform they want.
But I just heard you say there are things we can do to bring down costs. Right. I just heard you say that.
Right.
Republicans have been in power for a long time, sir. Why didn't they ever do any of this stuff? I mean, why are all their good ideas coming out now?
Well, of course, that's just wrong. I mean, we did a lot of these things, particularly in the House. Well, we did Medicare modernization with the Welcome to Medicare physical, health savings accounts, trying to make the program we'd committed to work better. But we said 7 times in 10 years. Now, listen, if you're going to ask the question, 7 times in 10 years we sent medical liability reform to the Senate. Never got to the Senate floor once. A half a dozen times we sent associated health plans. Those two things put together would have made a huge difference in the system, and we sent them over and over again. Only this year did the national media discover that it took 60 senators, apparently, to have any responsibility to do anything. We sent these over time and time again. I've talked about health care for years. We improved Medicare in significant ways. We created health savings accounts. We improved the whole idea of high-risk pools. And that's an idea that we ought to be expanding and using it more so that people who do have pre-existing conditions can have access to coverage. Access to coverage is the real question here. And the Republican alternative on the House floor was the only bill anybody offered that the Congressional Budget Office said would have reduced coverage costs for every single American that was going to buy insurance, individual purchases, big group, medium-sized group, or small group.
You probably know, because I'm sure you've watched from time to time. We do a very social media-oriented show here, so we have lists and we have people who we engage. And when we told them that you were going to be on, we asked all kinds of folks to send in questions. Now, the Democratic Party of Missouri tweeted us this, and we wanted you to get a chance to respond to it, because they're tweeting this out to our followers, and there's 100,000 people there. Wednesday's to-do list for Roy Blunt, they say: take insurance lobbyist money after bashing insurance reform in D.C. I mean, this is something you hear all the time, obviously, that, I looked you up. I did a little bit of my homework, and I looked to see how much money you take from the, you took, according to OpenSecrets.org, health professionals, $104,000, and from the pharmaceuticals, $71,000. Frankly, compared to other folks, that's really not that much.
Not that much. The pharmaceutical companies, by the way, spent $100 million last summer to try to get the president's bill passed. So, this idea that there's one side, that our side's defending the status quo, is just not true. It was the insurance companies that didn't want associated health plans that I voted for 6 times. It was the trial lawyers, clearly, that didn't want medical liability reform that I voted for and we sent to the Senate 7 times. So I think it just doesn't stand up. We're working as Republicans in Congress, and a lot of Democrats are on our side. Remember, the no votes on the health care bill, that was the bipartisan vote. 1 Republican voted yes, 39 Democrats voted no, and several Democrats voted for the alternative that we brought to the floor.
Congressman Roy Blunt, my thanks to you, sir.
Good to be with you.
For taking time to take us through this. We are now about 15 minutes or so, maybe a little bit more, from hearing the other side of this equation, which will be the president's response to Congressman Roy Blunt. And there is the president's venue, anyway. That's the high school where he's going to be speaking in just a little bit.